Hi, everyone. So this is our last session of the day, and my guest for this session is Amit Joshipura. He's the Principal Global Product Manager at Medtronic, and he's going to tell us a great story, focusing on a product that has changed many people's life. So please join me, welcome Amit on stage.
Thank you. Thank you so much. Great. Well, I'm very happy to be here. My name is Amit, like Severin has said. I work for Medtronic. Just out of a curiosity, who here has heard of Medtronic as an organization? Okay, good. So a very well-engaged group with the healthcare community. Yeah, so I'm super pumped to talk about the application that we are leveraging with Twilio. This is going to be a bit of a different presentation because we're going to talk a lot about our healthcare devices. It's a little bit light on the Twilio side, but I think it'll be interesting for you guys to understand how we're taking an amazing messaging platform and applying it to a great application in the health space that might not be as obvious or as something you guys would readily know about in our community. So I work for Medtronic, and Medtronic PLC is a large healthcare company. Diabetes is only one piece of it. We actually work in the cardiac business. We work in the neuro business. We have a lot of different divisions, but diabetes is who I represent. And I'm going to give you a bit of a healthcare lesson in diabetes to give you the world of what people have to deal with today and what the standard of care for diabetes is today, and then how our technology, coupled with Twilio, has been able to transform people's quality of life and their ability to manage the daily burden that is diabetes. So diabetes affects roughly 100 million people in America. So every year, 100 million people are dealing with either diabetes or prediabetes. It's a very serious condition. And the standard of treatment is typically for people to prick their finger. So actually, out of curiosity, here, who is affected by diabetes or knows someone that has diabetes? Just, okay, good. So, well, not great. It's unfortunate they have it, but there's some common understanding. So they typically have to prick their finger because everything about diabetes rests on their glucose value. So that's the indicator for people with diabetes, how they're doing. And for all of us who have a functioning pancreas that regulates glucose, we don't have to worry about it because our body is constantly self-adjusting to make sure we're in the healthy zone so we can operate every day as humans. You know, we're able to focus, we can work out, we can talk, we can communicate. People that have diabetes, unfortunately, don't have a functioning pancreas, and so they're not able to automatically regulate the insulin levels in their body, and they're going into high or low levels that can be very catastrophic to their health. And so what they do is they prick their finger to get a sense of how they're doing. That's their daily measurement of how they're doing, and they can make various decisions based on that reading. But the challenge with that existing paradigm of treatment is that it only gives you a moment in time. So when you prick your finger, that's all you have in terms of context to know how you're doing. And so really you have to prick your finger a lot to understand the pattern during the day, because everything affects your sugar level. The obvious effects are from food, from drinks, but even stress, work, intense work environments, lack of sleep, too much sleep, a lot of things affect your sugar, and so really you want to be able to see that full picture. So what we've designed is a solution that allows you to get a 24/7 constant monitoring of that glucose value. And so our solution is called the Guardian Connect Continuous Glucose Monitoring System. And just to give you guys a sense of the pain or kind of the lack that the current paradigm of pricking fingers has created. So I have a couple statistics here. 3 out of 5 people with diabetes are very worried about the risk of hypoglycemia. So hypoglycemia is when you go very low. And again, if you don't have if you're only pricking your finger, you might be missing those times when you're going dangerously low. And the challenge with going very low is that you can actually go into a comatose state and unfortunately pass away. So, parents, especially of children who have type 1 diabetes, are always gravely concerned because if their children go to sleep, and the thing with being very low is it can be asymptomatic. So you might be sinking in your levels and not even realize what's happening, and you will just not wake up. And so a lot of parents will typically, throughout the night, go into their child's room and prick the finger just so they can get an assessment of how their kid's doing, so they avoid that low. So again, with just finger pricks, you have no idea if you're going to go into those dangerous levels. Another grave statistic is that finger sticks can miss up to 78% of highs and lows. So again, you are not getting the full picture because you're only finger pricking at those times during the day. And so you're not seeing, again, that what's happening if you wake up, if you go to bed, or all the different activities you do during the day, what's the actual impact. And finally, unpredictable glucose levels have a big impact on daily life. So it really is about the quality of life. I mean, just imagine if you can't predict every day what your levels are doing, and that's making you not able to concentrate at work, you can't have conversations, you're feeling lethargic, you just can't perform the normal activities that create a good quality of life because your sugar levels are so unpredictable and so dynamic. And so again, without a solution like this, you really have no visibility. And so what we've designed is I have a little nice viewpoint here to show as well, that, for example, this person who does so imagine this is like someone's day in a life. These droplets that I show you is where they're doing the finger prick, right? Now, you can see that the finger pricks actually have a good reading if you consider being in that zone, a healthy zone. But look what's missing, right? The person is not capturing these peaks and valleys because they have no visibility into that, right? So if there's a technology that's allowing for them to do that, they could have more visibility into what's happening. And what frustrates them too is they think with these finger pricks, right, because they get these momentary glances, they might go to their doctor and say, listen, I have great readings because I have a healthy number every time I check, but now you're telling me that my A1C, which is kind of like the report card of someone with diabetes, how they're tracking over a period of time, you're still saying it's not good. And I don't understand that because what I see with my testing is that everything is A-okay. And so that causes a lot of frustration because then they go back and they're like defeated. They're like, I don't know what else to do because I'm only going based off of these measurements. So what we've designed is the Guardian Connect system. And what that allows is, so that is a phone. That's a phone. You guys know that. And then we have a sensor device that's next to the phone. And what that enables you to do is you have a sensor device that you put on your arm, and that sends measurements to your phone 24/7. And that sensor device has a small needle, it's 2 millimeters, that goes into your blood that's reading that glucose value. And that there's a Bluetooth chip in that device that then communicates to the phone, right? So now what you have is a constant reading. It's almost like a GPS for your body, right? And it's kind of like I say, it's like a beefed up Fitbit tracker, or all these trackers now that everyone's getting into. Actually, your iPhone is pretty much a bio tracker right now because it can do sleep tracking, it can do breathing tracking, it can do your heart, your cardiac rhythm, it can give your heartbeat. So this is essentially kind of one level up, right? Because there's a little bit of intervention with your body. You put it into your skin, and then it gives you that constant reading. And what's great about this is, well, not only is it's on your phone, so it's super convenient, it's actually discreet as well. Because a lot of people that live with diabetes do comment that, it's unfortunate to have it in the first place, but then for them to have to prick their finger, for them to have to take those injections, it doesn't look good, right? I mean, a lot of people actually sometimes ask people that have diabetes, like, oh, are you doing drugs? Like, what's going on there with your devices? And so this keeps it very discreet because they're looking on their phone. You wouldn't know otherwise that they're looking at their health information. And so it's a very user-convenient technology or solution. What's also nice is that you have these contextual pieces of information. So you can see on the phone these little graphics, which is the tracking of exercise, of food. So you can actually see real time what the impact of your activities are on your glucose values. and then you can make the appropriate modifications, right? So, what's interesting, for example, and a lot of people who have diabetes never knew this, but different types of exercise has different effects on people's glucose values. And the reality is that everyone's body is so different. So there's really no rule of thumb when it comes to tracking your health, right? So some people, when they run or they do aerobic exercises, their glucose goes up, whereas for some people it goes down, right? And you wouldn't have caught those nuances if you didn't have this type of system that is giving you that 24/7 constant feedback. So we've gotten a lot of people that have come back and commented that, your system allowed me to discover, that a certain type of exercise or a certain type of relationship, was very stressful and it caused a lot of ups and downs. And so you can now make more informative decisions to keep your health in track and then also just live a better quality of life. Now, you might be wondering, what's the Twilio application? So the other really important thing about this solution is that it gives you notifications, right? So not only is it a monitoring device that gives you that 24/7 reading, but it will proactively alert you or alarm you when it senses that things are going awry. So it will give you an alert if you're approaching a dangerous low level, or it will give you an alert if it approaches a high level, right? Which is very important, because that way you don't have to always be looking at your phone, but if you get a notification, you can know that something an action should be taken or something should be adjusted. So what we had been doing was keeping that information only to the patient, but then it was determined that parents in particular, as caregivers, wanted to also have that information, right? And especially, for parents who they want their kids to have a normal life, right? You want your kid to be able to go to the sleepover, go to the birthday party, go camping, but you're so concerned because their health and anything could happen to them and you have no way of knowing what's going on. So we thought, well, now that your child is equipped with this information, it should be very easy to go to the caregiver's phone. So we had actually approached another vendor and developed this messaging capability. So the phone goes off for the child or if it's a spouse or whomever, and then when that alarm goes off, it triggers us in our system to notify a caregiver that's been registered for this patient, and they also get a text message. Now, it's very important that that message gets delivered, right? The deliverability of that message is critical because we're delivering very important, vital information to parents or husbands or wives or doctors, and they need to get that message. And so we had been using a vendor that was good, but we really wanted to make sure that we had the best deliverability. And also, we're a global company, so our device is approved in regions outside the U.S. as well as the U.S. So we had to make sure that the texting capability would also be received in European countries and whatnot. So I still remember I read when we were looking to have the best solution. I was reading a Forbes magazine article about Jeff Lawson, and I discovered this company called Twilio. And I was reading the article, and they talked about how Twilio uses Uber, or rather Uber partners with Twilio, and I'm an avid Uber user, and I'm like, well, I love that communication, that message capability, and they get all my messages for Uber, so that's a good stamp of approval for us to use Twilio. So what's been great is, and I kind of made a little chart that shows whenever so you can see now with the system, if you get a low predicted alert through the system or a high predicted, that will trigger Twilio to send a message to the caregiver or the loved one that a situation is going on, right? And again, that deliverability is so important. We don't want to hear about mothers or fathers not getting that vital information. And so Twilio has been fantastic at allowing us to kind of expand the care team and make sure the physicians, the parents are all well equipped to handle whatever issues going on. So it's been a great relationship, and we're just grazing the surface with Twilio. In reality, I mean, we're just using kind of their basic SMS messaging capability, but the future of what could be possible as we expand our customer service to diabetes patients is what's also very exciting. So being able to send text, multimedia communication to the patients, like videos. Now that we're going omni-channel, could Alexa, provide some kind of communication, or can find you help around the area, or if there's lots of things now that we're like on a communication platform that could connect us to other third parties to make people have even easier time dealing with their diabetes management. So. And I think what's interesting, especially with diabetes and for a company like Medtronic, most of our business is very heavily in the surgical business. So actually all of our products are implantable devices, minus diabetes. And so our business has really not done a lot with this customer experience, because for a pacemaker, for example, you're not really texting someone about the pacemaker, right? It's pretty much like you go and you have a serious operation and then you don't have to come back for another 7 years until you change the battery, or a brain device implant. You're not really doing the same kind of high touch communication that you would. But for diabetes, it's a very consumer-oriented treatment. We have an online presence to buy diabetes materials, which is, again, very unique for Medtronic. So as we enter into this kind of new age of telemedicine, digital healthcare, digital counseling programs, having a virtual coach, there's a lot happening in this space that brings in the technology you already have, your smartphone. And so we want to make sure that we're on the cutting edge of that to give our patients the best experience they can have, and really be able to be a one-stop shop for them to, use their phone to send out information to physicians, order more supplies. There's a lot that we can do to bring, kind of your same customer experience that you have buying a shoe to doing that with health. And that's kind of what patients are asking. They're like, we want the same customer experience we have in the retail space, or, in buying a house or a car, and it should be the same thing for healthcare. It should not be a old stodgy experience of going to my doctor's office and filling out paperwork and having to go through records and look at blood logs, and there's just a lot of manual work that this could all replace. And I think Twilio can help usher in that ecosystem for us and really make that a competitive advantage for us in this space. So I think that's all I have. So this is kind of showing how the whole system works, but it's not that important. But basically, I want to just give this sense of how. So this is an example of a caregiver's knowing in real time what's happening with their patient because of the Twilio infrastructure. And I just ended with a quote that we have for a Guardian Connect user that really shows the vital necessity of this device being in these people's lives, and then how Twilio can expand that capability. So very excited to have this partnership. I'm glad I read that Forbes magazine, and that we started the discussion, because it's such an essential piece of our business to be able to communicate this health information to the caregivers and physicians. So we've had a lot of fun. It's been a cool experience, and again, the future is unknown, and it's now. There's so much that we can do to expand that capability. So. Yeah, that's all I have for you guys. I'm happy to take some questions. I think we have some time. Yeah, we have about 10 minutes. So if anyone has.
Do you have to deal with HIPAA compliance? And if you do, how do you handle that? Basically the question of, is Twilio HIPAA compliant is a question I get all the time.
So absolutely. So we took from that day where I read the magazine article to when we actually got Twilio into our infrastructure was about an 8-month process. And a lot of that was to ensure that Twilio had the appropriate, phone redaction capabilities to de-identify the patient phone numbers. And we went through all the capabilities that Twilio has to ensure that they are HIPAA compliant, that they're able to protect the patient information, phone numbers, everything is de-identified, it's redacted in terms of nothing is saved on any system, because all of that is private information. So that was a significant due diligence to ensure that this was something that was compliant. And we worked with our legal team, their legal team, and it was all brought together to ensure that this was a appropriate solution. So very valid concern. That was, HIPAA is a huge issue, and as the whole industry is going into telemedicine, I know Doctor on Demand is actually a customer here as well, and I'm sure they have very similar challenges where it's like now people want to have that transparency and that convenience of using their phone, using their personal devices, but the industry itself has been a bit slow to adopt, to kind of move to that, but we were able to navigate those issues with Twilio. So that's a great question.
Has Medtronic looked into using something like Twilio Flex or an agent console to offer caregivers the opportunity to coach patients?
Yeah, absolutely. Yeah. So we are really looking into what is the best way that we can scale our health provide health services, and so Flex would be a fantastic example of having nurses on staff or remote nurses, because it takes a lot of investment overhead to build physical contact centers that have physicians or nurses that are there waiting to get these calls to treat patients. So I think the more that we can make that virtual, scalable, remote would be fantastic. So we don't use Flex right now. That hasn't been we haven't talked through that yet, but we're absolutely interested in how we can create solutions that make things, and especially with diabetes, sometimes you want real-time intervention, right? So imagine what we could do if you got this alert and that triggered a call, to a remote agent who was sitting there and had visibility into your data and could then coach you at that time, right? Because a lot of the challenges is physicians give a lot of advice to their patients at the clinic, but then they go back into their real life and then they forget, or it's kind of like, and I don't want to imply that diabetes patients are like dogs, but it's like with a dog, if they do something bad, you have to yell at them at that time or they're going to forget, right? And so it's kind of like a similar, it's like you want to be able to help the patient right there and then, and so that could be an amazing extension of that, because that could do huge improvements to the care. That's a great question. Anything? I know I'm between you guys and dinner, so it's always a tough spot, but yes.
Just back to his HIPAA question, is it because you have a proxy where it's anonymous who the caller is, or the text person that the notification is going to, or you don't know?
Well, so from my understanding, so we the caregiver will obviously put the phone number, the person who has a system will put the caregiver's phone number in our system, but the information that's getting passed is being redacted, or is being blinded, so that it's not like we're storing that information and that we can do anything with it. So I think it's the communication channel is encrypted, or it's anonymized to ensure that we don't even know what's happening between the communication. Does that make sense? So it's that keeps us protected, it keeps Twilio protected, because there's no storing of that personal health information that's getting communicated. We're just providing the system to facilitate that channel or that conduit, but we're not storing any of that data per se in our systems, and that's how you avoid, because that's where HIPAA, our lawyers were concerned. They were like, you can't store this data. This is private health data that's happening to patients. We can't know what it is, but we want to provide a system to be able to facilitate that. So it's all in, yeah.
And wouldn't then Flex be non-HIPAA compliant, because then that information wouldn't be stored?
Yeah, that's fair. Yeah, so I think we'd have to think through how we, we could probably anonymize the numbers potentially, right? Just like how with Uber, you don't know the number you're calling when you call your driver. So, yeah, I don't know enough about Flex to understand how they're thinking through that. I don't think Flex has any healthcare applications right now, or any companies are using it. I don't know that, but that'd be a fair point. Insurance uses, yeah. So, yeah. Good. Awesome. Well, thank you again. Oh, never mind. That was one question. Is he good?
I can ask you if it's okay.
Yeah, please.
Is Medtronic working on any product specific to because you're managing blood essentially and levels. Anything related to alcoholism or addiction recovery or opiates, we're in addiction recovery.
Yeah.
And we're looking for similar monitoring systems post recovery.
Yeah. So I mean, I don't think we're looking for something specifically to measure like alcohol levels per se, but yeah, no, I think that's an application we haven't explored yet, but that could be interesting. Yeah, but again, like, it could be a very similar concept to you could apply to whatever you guys are doing, where you measure and then it goes to the phone. So, yeah, for sure. All right, thank you. I appreciate your time. Yeah, thank you.